If you are watching this, you've likely been told your neuropathy is idiopathic. That word is the medical equivalent of a surrender. It means the system stopped looking for the cause and decided to start managing the symptoms, usually with a cocktail of pills that sedate you without fixing the nerve. At Regenerve, we reject that model. We are here for the sovereign seekers. Peripheral neuropathy is not a mystery. It is a signal. And if we treat it as an assembly line diagnosis, we miss the breakthrough. Today, we dive into the science of a true therapeutic breakthrough, the high concentration 8% capsaicin patch protocol. This isn't just treatment, it's a reset of the biological soil and the first step in our reanimation journey. To understand why we use this at Regenerve, you have to understand the mechanism. Your nerves are failing because they are in a state of hyperexcitation. We use an 8% high concentration capsaicin patch, not the wheat creams you find at a pharmacy. This patch acts as a TRPV1 channel agonist. It temporarily defunctionalizes the pain-sensing nerve fibers. We are essentially hitting the reset button on the hyperactive signal that is causing your burning and pain. It gives the body a 3-month window of relative silence, allowing the damaged nerve tissue to begin the reinnervation process without being overwhelmed by constant inflammatory signaling. This is the physiological calm before the regenerative storm. We apply the 8% high concentration capsaicin patch directly to the area of hyperexcitation. It requires a precise 30-minute application to be effective. This clinical protocol provides the body a 3-month window of relative silence, allowing the damaged nerve tissue to begin the reinnervation process without being overwhelmed by constant inflammatory signaling. Now, here is where the standard model fails you. Most practitioners apply one patch, see no immediate miracle, and tell you it didn't work. That is clinically incorrect. The real-world data from the CASPAR study reveals the truth. This is a cumulative therapy. Look at the trajectory. Success rises dramatically with successive applications. Persistence is a clinical requirement. By the 4th treatment, we are seeing success rates as high as 97.7%. This isn't just pain management, this is disease modification. We are seeing a progressive reduction in allodynia and burning. And biopsies show that repeated cycles actually promote healthy nerve fiber regeneration. We are literally rebuilding the interface between your mind and your environment. At Regenerve, we operate on the 3-treatment rule. Clinical data proves that responder conversion is real. Nearly 72% of patients who were considered non-responders after their first or second application actually achieved life-changing relief by the 3rd cycle. If you quit early, you are walking away from the finish line. We do not surrender. Once the signal is quieted, we activate the repair. Our orthobiologic hierarchy, utilizing PRP, MFAT, and BMAC, is deployed with sub-millimeter precision. Under power Doppler, we target recalcitrant insertional pain and calcific tendinopathy. We aren't just injecting, we are re-engineering the structural integrity of your musculoskeletal system. We also address the strongest metabolic predictor of chronic pain, visceral fat. Forget BMI. We prioritize the metabolic score for visceral fat and the visceral adiposity index. Central obesity is the engine of meta-inflammation. If we don't address the leptin mechanism and the NLRP3 inflammasome, your recovery will always be temporary. We analyze the biological soil for LDL-P, TNF-alpha, and IL-6. If your terrain is toxic from glucotoxicity or lipotoxicity, the nerve cannot heal. We address the gut-brain pain axis, dysbiosis, and the musculoskeletal syndrome of menopause. We fix the environment so the reset holds. This is the Padda protocol in action. Beyond the biochemical, we address the biophysical. We utilize photobiomodulation, class 4 lasers, to target cytochrome C oxidase. This triggers mechanotransduction following the Arndt-Schultz law. A weak stimulus accelerates physiological activity. We are providing the energetic fuel your mitochondria need to drive cellular repair. This is the Regenerve stack. We utilize mitochondrial restorers like MAUT-C and SS31 to reverse brain energy failure. We utilize the Wolverine stack of BPC157 and GHK-CU to modulate thousands of genes and synthesize collagen. We are reanimating your metabolic system, treating muscle as the primary organ of longevity. We also look at structural failure. Many patients suffer from plantar fasciosis, not ITs. It's a degenerative condition, not just inflammation. We analyze the windlass mechanism and utilize focused ESWT to trigger VEGF for recalcitrant insertional pain. We fix the mechanics while we heal the metabolism. It isn't just about the pain score. The data is clear. 4 treatments yield up to a 93% improvement in sleep quality. More importantly, we reduce the pill burden. We help you taper off opioids and gabapentinoids, ending the endorphin bankruptcy caused by long-term drug use. We are removing the toxicity so you can reclaim your sovereignty. If you are ready to move past the idiopathic carousel, you need a protocol, not a pill. We combine high-concentration capsaicin with deep metabolic profiling and orthobiologic hierarchy. This hospital-free 18,000 square foot facility in St. Louis is designed for one purpose: your recovery. Your journey to metabolic sovereignty starts now. Stop managing the alarm, find the fire. If you're ready to see if you are a candidate for our regenerative protocol, visit us at regenerve.com. I'm Dr. Padda, and I'm here to help you get your life back. Find the fire, fix the terrain, and reclaim your health.